My name is Hope and I'm a neurologist. My office primarily deals with central and peripheral nervous system findings to evaluate and diagnose mental diseases. Qualifications for this job include at least 5 years of experience in the field beforehand. This office is highly known with high credibility. In order to attend, you must have a medical prescription from a referring physician. All ages are welcome so long as the referral is made, but majority of patients tend to be over the age of 65. Alzheimer's disease is very common. In just the last year, I have seen 1 in every 25 patients to have this disease. Common symptoms include memory loss and confusion. Patients' behavior, mood, speech, and psychological function may fluctuate as well. Jumbled speech is another symptom, but typically only seen in progressive patients. Commonly prescribed management plans include effectual drug therapy and prescription for occupational therapy. I have found it best for patients to attend therapy 3 times a week as this keeps their physical exercise up. When diagnosed with Alzheimer's, it's important for family to be around as much as possible to help exercise the patient's memory. There is no cure for this disease, so typically those who are diagnosed pass away with this disease because the amyloid plaques and neurofibrillary tangles in the cerebrum eventually take over. My patient is a Caucasian male, age 68. He is high on the socioeconomic ladder. This will help as his family will be able to hire a personal therapist to come to his house to do therapy, as well as have a personal nurse to stay with him at all times, enabling he take all his medication and is doing his normal daily activities. He can afford all medical prescriptions as well as attend special groups that directly focus on his mental disease. The patient has been diagnosed with Alzheimer's disease. I recommended him to take cognitive enhancing medications, antidepressants, occupational therapy, and attend Alzheimer's group practices in a clinic, as well as being around family as much as possible. He is in the early stages of Alzheimer's, so spending time with family as much as possible will help exercise his brain more. Alzheimer's disease is a serious mental disorder. Many elderly are diagnosed daily. Craniotomies don't serve this disease well since there is no cure. By gathering symptoms, doctors can conclude the disease to be Alzheimer's. Symptoms include memory loss and confusion from the degeneration of brain cell connections, eventually destroying memory as well as other important mental functions. Some recommendations on preventing this mental disease are staying physically active with a healthy diet. That includes healthy fats. Healthy fats have helped prevent Alzheimer's. One may also supplement fish oil into their diet as a preventative. It is essential to convey to other health professionals who are treating patients with Alzheimer's to provide the right prescriptions for therapy and medications, as well as give the family the best options based on the diagnosis levels. Since this disease can progress at a rapid rate, it is important to make sure family members understand the severity of the disease and remain supportive of their kin. This can be a difficult time for all parties involved. The major problems that still need to be solved with this disease is finding a cure and finding better ways to prevent it. Numbers are extremely high in elderly, and not having a cure for this mental disease causes many family members heartaches due to the high numbers of patients who pass away to this disease.